Good morning and good evening. Here it is very late in the night. It's around 9 o'clock at night. So, welcome all of you to this African chapter of American Academy of Optometry. This is our second webinar on our various sessions, and we have very two eminent speaker. Before we start off with their sharing of knowledge, we would request for a volunteer to help us with a prayer, opening prayer. Okay, let us bow down our heads. Heavenly Father, we thank you for the opportunity to gather virtually now. We ask for your presence to fill this online space, guide our discussions, enlighten our minds, and help us to make the most of this time to learn and grow. In your name, we pray. Amen. Amen.
Amen. Amen.
We shall now request our lead of the scientific committee of this African chapter of American Academy of Optometry, Dr. Godwin, to give his opening remarks.
Thank you, Tanuja. Good evening, everyone. Just want to use this time to welcome everyone to this session tonight. And just to quickly give us why we are doing this, it is to provide support to candidates who are writing their case reports. I'm sure some of us have turned in our case report, and we should be getting feedback from our respective reviewers, and they will be expecting for us to do the corrections and get ahead with the process. One of the motivation for us to do this today is because of how important it is for us to appropriately respond to, reviewers' queries, and the reason is because if you don't, you're going to delay your process of completing the process. Two, you're also going to make yourself work much, much harder. Take, for example, you present your first case report, this reviewed, sent back to you to make corrections. You do it, you go through it all over again, and then you submit. It is going through a second, a third, a fourth round of reviews. All of those time they are using for review are the time we would have used to develop a second and a third report. So it is important that when you write your case report, you write it appropriately. And when the report comes back for review, look at what the reviewer has said and try to address them as completely as possible, so that you also save time for yourself, and you also save time for the reviewer. Because if the reviewer will probably be reading your paper 1, 2, 3, 4 times before he gets it across, that's going to be a lot. So that's why we're doing this evening, because we know that before long our case report will be coming back to us for correction. So that's one of the main reasons we are doing this evening. And we have two eminent persons that will be speaking to this issue today. We have Mariche, who is quite experienced, and we're also very fortunate to have Obinwanne, who himself is a subcommittee chair. So he'll be providing perspective from the academy, what they are looking out for when they are looking at this paper. So I just wanted us to do this evening, and once again welcome everyone to the session. And I hope we're going to also be having, after the presentations, there'll be questions, discussions, and maybe also share your experiences of maybe what you have had when you review your paper and things like that, so we can help support one another. So on that note, I want to say thank you for joining us. And Tanuja can take it from there.
Yeah, thanks, Dr. Godwin. You made it very simplified, but I was always nervous whenever we used to get this reviewer's remarks. So let's understand the principles of responding to reviewers' comments from Dr. Richter. She's a senior lecturer from University of Joburg, from the Department of Optometry of University of Joburg. Dr. Richter.
Thank you so much. I just want to see, I'm going to share my screen. Can you all see the screen? Can you all hear me? Is it available?
We can hear you and see also.
Okay.
Thank you.
Thank you. Let me just get that going. So, yes, I think this is a very not sometimes easy one to present because everybody have to respond to their reviewers. And when Godwin sent me the WhatsApp, I initially, I don't know actually if he noticed, but I initially responded and said, yes, I will do it, because he said responding to the reviewers, and I was thinking, which article is this that I need to respond to? And then I read the message, because your brain is always in this mode of, okay, where do I now need to respond to? So I thought of how do we actually respond, and I think that is the crux of the matter is, yes, we should respond, but the main thing is how should we respond, and that remains the question. So when I had to look at which words actually comes up, the main thing is also, do we respond with emotion, or do we really have to think about the manner that we respond in? And that is why I've got the picture of the brain, because I think we do need to think about the manner in which we respond, and also in the format we respond. So a few of the words that came up when I had a look at this was calm, thorough, clearly, polite, respectful, correct, with patience, thorough. So all of these words came up in a sense of thinking about the manner you respond to these reviewers, because they take the time to look at your document. And when I put this together, I had a look at it not only from the point of view that we respond to our cases that you submit, but this would be for an article, it would be for you, it can be for your dissertation, it can be for your thesis. Actually, anything that's being reviewed, you can make use of these suggestions, and then it is probably much easier then to have a look at what the reviewers are saying. So having a look at this, responding to reviewers, what would be the first one would be patient, be conversational, and then, as we said, be thorough. So you'll see as I go through this, some of these themes keep on appearing right through. So if we have a look at why am I'm frozen? Sorry. It doesn't want to move forward. There we go. Sorry. So if we have a look at being patient, what is suggested? These narco wars and the Okay. What is being suggested is take some time to read through those comments, because sometimes your first reaction is they don't know what they're talking about, and you want to you want to respond immediately, and sleep on it, reflect on it, take time to think about. Okay, take some time and reflect on what is being suggested. Look at it from a point of view that these reviewers made suggestions to improve your document, if we're referring to an article, but also to improve your case report, to improve if it was a dissertation. It is not to penalize or criticize, but it is an opportunity for you to go back, have a look at what you've presented, and then to improve on what you've submitted. Make sure by taking your time, being patient, that you really understand the comments and maybe the instructions from the editor, that you can then make those necessary changes. You can be conversational in the sense that being appreciative and thank the reviewers for their contribution, because it's also their time and effort that they've put into this document to provide you with feedback. Be respectful, and then also when you respond, be clear with a direct response in terms of feedback or comment to what the reviewers have said. Don't be emotional, and I think that assists with the fact that you should take some time. And what I mean by take some time, it is not 2 or 3 weeks later, but don't respond immediately to what is being said, and then accept if you made mistakes, because we can make mistakes and that can be pointed out by the reviewers. And then be thorough. So address substantial changes. That first would sorry about this. I just want to get this out of the way. Sorry. Address substantial changes that would improve the quality of the document. And then look at the other requests that may or may not add value to your document. So that's not to say that when you look at the request from the reviewers that you have to make all the changes that's been requested. You are allowed, obviously, to argue points respectfully if you disagree. However, you can explain in detail to the reviewers if you want to address their concerns, but this can occur in a respectful manner. Sorry. So the first one, as we said then, is to stay calm, and this is the calm response, and this has been suggested by Elsevier. Is if you look at the acronym, then the C would be for comprehend or keep your cool. So as we said, take time to understand the comments, process those comments, think about it before you respond. And also in that process of thinking about these comments is gather your thoughts. So it's not a jumble of words when you complete the response later, or when you look at your case study then, and you have to make certain changes, that it's just not a string of words that's being put together. If we look at the A, then answer or amend what you submitted. Be objective in terms of what you've done. Obviously, look at it as an opportunity to strengthen what you've submitted, and also strengthen your arguments, being either for what the reviewers have said, or then if you may disagree, then try to support that disagreement then with certain evidence, such as literature, improve your data, whatever is required to support then that specific disagreement. In terms of the L, list or check it, list what works, and this works for me, and you can work according to what you find sufficient for yourself, or there might be a specific way that's required, but list the reviewers' comments and address it specifically I use a table where I would list the reviewer's comment and then respond with my specific answer, how I have addressed that specific concern or comment or whatever is required. And I would also then indicate on which page that was, or a specific line, because if you submit an article to a journal, you would have the lines numbered, and that make it easier for the reviewer to go back to the specific line to see where you've made that specific change. And you can also copy the specific sentence where they require that change back into the table or the sentence, and that would assist the reviewer when they have a look at that document again to see where you've made the relevant change. But it makes it easier when these changes are listed rather than sending a whole document and there's no order in terms of how you've done your changes. And then, as I said, be mindful of the fact to make this easy on the reviewer, because it might be the third or the fourth time now that they look at this document. And the more you make it easier and assist with the process, the better it is for you and the reviewer then to look at it. So your relevant documentation that you should include when it is being returned to the reviewer is a cover letter to indicate what you've done, the list of the responses, meaning reviewer comments and how you have addressed that specific reviewer's comments, a track change document, and a clean version of that document is also required. So in terms of some journals, they would require both. Sometimes when your article is 20 pages long and you submit a track change document, obviously it makes it so much longer, and the journal actually don't want that track change document. They only want a cleaned up document. That is then obviously where your comment list or your table that you submit, or however you would want to submit your comments from the reviewers, then makes such a big difference. And it's being said that sometimes your response letter back to the reviewers can be 2 pages, 3 pages. It's been indicated it can be 40 pages for that matter. But as long as you make sure that the list of responses is included. Then I like the acronym, there can be a correct response, or there should be a correct response. And the C would be, when you respond, be courteous and clarify. So thank the reviewer because they take time to spend time on that specific document, and be respectful even if you disagree with them. They may be a subject specialist, may not be a subject specialist. However, they were asked to look at that document, be polite. And remember then, if there's a misunderstanding or a misinterpretation, it may mean that in the specific document you submitted that it is not sufficiently explained, and now you've got the opportunity to clarify that or rephrase it to make it clearer, and that stands out so much more. So that would be the C. If we look at the O, organize and outline. That comes back to the L in the calm in terms of the list. Respond point by point and in the same order. So as the reviewers are commenting, that is how you set up your response point by point, and you address each one. And also, it makes it easier to note the page and the line number, because when it comes back to the reviewer, they often don't have time then to page through to check up where you've made the changes. And it's so much easier for them then to just go back to the page number or the line number for that matter and have a look at how you've changed it within the context of that document. In terms of your response letter, and sometimes this is important for the journal, is how this is put together. Address each comment directly with an answer. You don't have to agree with all the suggestions. However, you have to address all the suggestions that has been made. There should be a short introduction in terms of your response letter. And then it's suggested that there should be sections within your response letter with headers to make it easier for the reviewers to check what you've done. And then each item should be clearly recorded either for the editor or with the reviewer's words, so that is clearly distinguishable. And then when you get to revise, indicate exactly where the relevant changes were made. And here it suggests it doesn't really matter how you do it, but you can make use of a different color, a different text, type size, or indent. So that is just easier to stand out and for the reviewer to check where you've made the relevant changes. Obviously, Word makes it easier with track changes. Where possible, do what is asked. And you can, if you look at the changes that's requested, you should differentiate between what the review was from what was done between the editor and the reviewers. What is your response? And then the relevant changes to the document. And then remember to also submit a cleaned up document. So you can have the document where you've incorporated the relevant changes, but then submit a cleaned up document as well. If we look at the E in terms of would be explaining and evidence-based. So support your arguments if you don't agree, or if there's a point that you want to argue, support that specifically then with literature or data to defend your position. There's nothing wrong to say, I don't agree with the position, or this is a paper that you may not have seen, or this paper also supports what we've said, but that the argument should be supported by literature. And then clear communication, confirm compliance clearly in the response letter, and be clear in your communication. And then remember to thank the reviewers for their feedback. So in terms of just an example of a response, so this would be as you address each and every comment. So reviewer 1 commented on Obinwanne et al. 2021. And then your response would be on page 5. I added discussion to strengthen the argument of Obinwanne as it relates to low vision children. The revised text now read, low vision in children is not well researched, especially in Africa. It was found that, and then you can just type in. So it just you would highlight as a suggestion what the reviewer's comment was, and then type in your response. Another one would be the reviewer mentioned paragraph 6, lines 5 to 7 is misleading in the manner it refers to the number of visual examinations. And then your response may be, I agree that the order of information is misleading. And then the paragraph has been rephrased and you indicate how you've done it. So you just make it a little bit easier for that person that has made the comment then to check where you have done the changes. This was a very nice article that I did find that actually has given some tips, guidelines, and then also key points to have a look. And this is actually repeating some of what I've covered already. But remember to address the reviewer's critique and value that feedback that was given. And when you address the reviewers, avoid personal comments. It's not personal. It is, as I said, it is that the comment is given to improve your document. So see feedback as an opportunity, address the comments systematically, and evaluate it objectively. It's sometimes difficult to keep emotion out of it, but it is important that you open yourself up to the positive side of it and look at it in that manner. Be polite and respectful, as I said, to all the reviewers. Maintain professionalism and gratitude. Proceed with the revisions, indicating that you take the comments seriously because your reviewers has also taken time to go through your document. And try, in terms of your comments, not to be confrontational or defensive. And when you respond is read through those, give it to somebody else, possibly to read through it as well, that they can check the tone and the response to make sure that there isn't those defensive and confrontational tones present. Read carefully and understand the comments, because it's quite possible when you read through the comments that you may not understand exactly what is asked. And that is sometimes good then to also ask your co-authors to have a look at the comments and discuss it with them. So thoroughly examine and categorize your comments, break it down into separate points, and also distinguish between positive feedback and critique, and have a look at where you can respond and where it would be constructive in that case. So prioritize your feedback in dealing with major revisions first. And major would be if there were comments about the methodology or the results or the conclusion, and that should be addressed first. That's sometimes the most difficult to do, and then move over to the minor ones. The major changes that's requested, that will improve the overall clarity of that specific document. Pay attention to details. So address those points individually and maintain something that's very important is maintain the originality. I can remember when I did my master's degree, and that was many, many years ago, when I received my 8th draft, I decided that was it. I am not going to make any more changes, because it wasn't my document anymore. I just said, that's it. Because every time I submitted it, there was a change requested, submitted, there was a change request, and I said, that's it. And when it was a clean version that came back, I thought I needed to frame this, because really it was a good day. It was really a good day. So remember that, to maintain originality, and while incorporating the feedback from the reviewers. So you can, when you get that feedback, you can add additional resources where it's appropriate. So if you want to add additional articles that you found to support the arguments, that is allowed. You can make minor corrections to improve the clarity, but, big but, avoid plagiarism of reviewers' comments. I find it very often with students that when we make comments on their proposals, you would write something, and then when it's resubmitted, you're actually reading your own words, because they have copied your comment and just inserted it in their document. So be careful of using the reviewer's comments as it was provided. Don't argue every point. So in sense is you should make necessary changes where appropriate. It's being indicated that you shouldn't actually argue more than 2 points, and only refute the suggestions where you can provide validation. And as we said, provide evidence then when you want to refute any suggestions that were made. Be thorough and plan your response. So if you look at your response letter, and when you want to respond to the reviewers, organize those responses and systematically address them, and be clear and be professional when you do that. Highlight the changes in the manuscript, revise the manuscript, and then obviously look at the changes that was suggested that will improve the manuscript, incorporated in that way, and think about it in that manner, is that your reviewer is there to assist you to improve your document after all. So make it easy for them when it's resubmitted to see the relevant changes, and you can highlight that and underline however you want to in terms of your typography, so that it's they don't have to go and they don't have the time to read through the whole document again. They want to see if you spend the time to address whatever was suggested. It's important then, specifically when it comes to figures or tables or diagrams that may be suggested, that you look at the submission requirements of the journal, and it may not always be possible then to incorporate those suggestions if you've already maximized in your article. Initially, if the journal has said it's only 3 tables allowed and 2 figures, and the reviewer suggests to add another table, you need to look at the submission guidelines and then indicate, but it's not possible to add another table because then you are not within the guidelines, or if you are limited to a number of pages or the number of words that is stipulated by the specific journal. And then also, when you have got your final manuscript, make sure that you check for errors and that it is clean, and that there's no spelling errors or lines that's being skipped or anything like that. So review again, make sure that it's there is no errors due to the changes you've made, and then also declare the use of AI tools. I don't think there's anything wrong where you would use Grammarly to improve your language use, as long as that is declared. And nowadays it's required by many of the journals that you actually indicate that you've used something like Grammarly to check your spelling. I know Word has got its own spell checker, but some of the other AI tools is a little bit better in terms of that. But declare then the use of that and resubmit promptly. And I think that is what Godwin has indicated as well. It doesn't help. It doesn't help to sit on that case or sit on that article for 6 weeks and then try to make the relevant changes, because by that time, the reviewer has forgotten what they had suggested, and you have forgotten what you tried to say. So resubmit within a reasonable time, but with the detailed responses and highlighted changes so that it's fresh in the reviewer's minds. Remember to include your cover letter and response table. So I use a table, but whatever how you want to respond, and demonstrate the commitment in terms of trying to improve the document that you are submitting. So some examples of responses, and the reason why this is up here is that you don't start all your sentences I agree with, or yes or no, that you just change your responses. We thank the reviewer for pointing this out, or we have removed, we agree and have updated, or we have fixed the error. So if you look at the responses, it's not we agree and have changed, we agree and have changed. You can change up your responses a little bit more. Or if you then look at a response where you may not be in agreement with the reviewer. So I agree with the reviewer that further elaboration on this point using new data would be helpful. However, we believe that expanding our data set is neither feasible given the cost involved, nor would it significantly support our argument. So here you can see you are respectful in the manner, and you're saying, sorry, but we don't think making this change is going to really make the argument stronger. So you're saying it in a very nice manner. So I think we will leave the questions probably after the next presenter has finished. Thank you so much.
In short, our senior lecturer from the University of Joburg, Dr. Richter, advises us to go through yoga session before responding. Be calm, be patient, be reflective, and be respectful. Accept one's own mistake and showcase improvements. She also nudges us to choose our battles. We shall try to comply with most of the request of the reviewer, though we are not obligated to agree with every suggestion. But as she pointed out in the last part of her talk, to how to diplomatically agree, but make them agree, or you can disagree to their point, but do it diplomatically. Justify with some reasoning, with logical evidence. Of course, we have learned to address the response in a correct manner. Hope we have paid attention to the acronym she mentioned: correct, courteous, organize, response, revise, evidence, clear communication. Thank you. Thank you to the reviewer as well as Dr. Richter. We have a question on the chat box, but it was already Dr. Levy responded, but you can have a look at the question from Dr. Paul. How do you approach review comments that are asking questions or information which is already there in the manuscript? Recently, I received comments from a reviewer who I suspect used an artificial intelligence to review the paper. So he's asking for a suggestion how to go about in such case. Dr. Levi has responded.
Oh, yes, you responded. Okay, that's fine.
Yeah, but if you want to add something to it, please go ahead and add. He did respond that you can draw the attention. Of course, ma'am mentioned to highlight in your successive
Yes.
draft so that it draws attention to the reviewer.
I think exactly that is where we said be courteous and just say that it has been addressed on page whatever, line whatever, and not be, but I think this is something that will happen more often, that AI is being used by reviewers as well because they don't have time. So although, we need to maintain that level of professionalism, we can just refer them back to the article to indicate it has been addressed already.
I hope Dr. Paul is clear about this. Let's move on to the next speaker. Dr. Obi, Head of Cornea, Contact Lens Myopia Control Services, D-Lens Ophthalmics Family and Vision Care Center, Abuja, Nigeria, can navigate us on how to respond to the reviewers. Over to you, sir.
All right. Thank you very much, Tanuja. Marike, I think you need to stop sharing your screen. Marike, you need to stop sharing your screen so I can share mine.
Dr. Richter, are you there?
I'm not sure if you can hear.
Obviously, if you can try sharing, it's possible
Let me
to share
try.
multiple screens. But I will give her a ring. Maybe she
Nah,
can.
so it's asking me, it's
That's okay. I've allowed
now,
it. Yeah.
okay, yeah, yeah. Okay. All right. Good evening, everyone. I hope you can see my screen. So I'm Obinwanne, and I'll be talking about responding to comments for your AAO case reports. So Dr. Marike has highlighted on responding to comments in general for scientific writing. I'll be specific to AAO reports. So first of all, why you're writing a case report? First, you're trying to become a fellow of the academy. So most times, if you're writing a case report, you're going through the clinical route. So we want to see how sound you are clinically and how you approach patient management clinically. And if you've gone through the process of writing case reports, or anybody who's gone through that and has become a fellow of the academy, you would agree with me that it's made you a better clinician. It's made you more attentive. It helps you understand why it's important to practice evidence-based optometry. Keeps you abreast with current literature. Even if you went through the research route, the same thing as well. Puts you on your toes and makes sure you're up to date with evidence in the area of research you've done. Now, you've written your report, it's been sent back to you with some comments. These days, the biggest reason why we're having case reports sent back is plagiarism. And I mean, this was an issue about 2, 3 years back. Thankfully, the Academy has, the African chapter as well as the Academy, I must say, has found a way to curb issues relating to plagiarism. So there is now a plagiarism course that all candidates must undergo. including attaining 50 points before you're eligible to sit for the oral exam at Academy. And also, the African chapter has given series of lectures on plagiarism and how to combat that. And also, there are several free plagiarism tools that you can use in scanning your reports to detect if you've plagiarized. What's acceptable from the academy is less than 30%. So if your plagiarism is less than 30%, when we scan the reports, when it comes in, we would accept it. If it has AI content more than 30%, it will be sent to the ethics committee. The AI part is evolving because now the tool that we use in screening reports can pick up AI. And even if you've used something as simple as Grammarly, Grammarly is still AI. So while it may be okay for you to use Grammarly to correct your grammar for scientific reports, for academy reports, for now, I would say if you can use just the grammar or spell check in your Microsoft Word document or whatever Word document you're using, I would advise you use that. Because we're having some reports coming back with high AI content, and it's just because the candidate has used Grammarly. It doesn't mean that your report will be rejected because you use Grammarly. It's just going to go through that long process of going to the ethics committee. Then you will get an email that there was a high AI content, and you send it back, and at the end, it turns out to be nothing. It was just Grammarly. So to avoid all that delay in your review, just use the spell and grammar check in your Microsoft Word document for now, so that you don't get that delay. Obviously, if you've used a lot of AI content aside from Grammarly, like ChatGPT and stuff, it will pick it up very easily. And if it's quite high and it turns out that that high AI content is not from Grammarly, it's from something like ChatGPT or OpenAI or any other AI tool you may have used, your case reports will be rejected very fast. So watch out for plagiarism, keep it below 20% as much as you can. And AI content, keep below 30%. Another reason why it's commonly case reports are commonly rejected is lack of coherence in your write-ups. Sometimes, I mean, Marike is also a reviewer. So when we review cases, it's always interesting when you're reading the way someone else has managed the case and the case flows. It follows the SOAP format. So SOAP is subjective data first, then objective, then your assessment and your plan. The way everything flows, it's nice to read such cases. As an individual, it's pretty annoying when you're reading something that doesn't flow or sounds very incoherent in the way it's written. You're seeing objective findings first, later subjective findings comes up. There is no plan, there is no differential diagnosis. All those things makes the whole report look terrible. So make sure that your report is coherent, one. Make sure, two, it follows the SOAP format, and ensure that each visit, you have everything that's relevant repeated. For example, if you're writing a case on maybe venal keratoconjunctivitis, and you've talked about the history, you've talked about your examination, you've done your objective assessment, and you've looked through the differential diagnosis. Keep in mind, it's always important for you to remember your differential diagnosis should come before the first final diagnosis that you give. This is a common mistake we see in reports. You would have someone write a final diagnosis and maybe 2-3 pages down the report, you're explaining a differential. You should have explained that differential before you arrived at the final diagnosis. And don't just list differentials. This is another reason why case reports get sent back. Don't just list the differentials. Discuss each one, maybe 1 or 2 paragraphs with citations. Discuss each differential and the reason why you ruled it in or why you ruled it out. And it has to be a differential that makes sense. For example, if we're talking about the case of venal keratoconjunctivitis, for example, a sensible differential could be maybe other forms of conjunctivitis, It could even be seasonal allergic conjunctivitis or atopic conjunctivitis. But you put in something like orbital cellulitis or Dacre cystitis in the list of differentials for something that the final diagnosis is venal conjunctivitis does not make sense. So it has to be something that makes sense and something that is similar, and you have to explain how you ruled it in or ruled it out with citations. Another reason why your report might be sent back is on the follow-up visits. Again, let's still use the case for VKC. You've written a case about venal keratoconjunctivitis. Patient has come for follow-up. Maybe you dispense some medication, maybe a mast cell stabilizer, ketotifen, or some antihistamine, something. And the patient has come for follow-up, and to you, you've just written patient felt better on follow-up. Maybe you wrote visual acuity, no slit lamp findings, and then you just write patient was asked to continue medications. There are certain things that are important when it comes to follow-up visits. So we know in clinical practice, you're not just going to assess VA, then talk to the patient and the patient says he feels better, and then you write that you saw the patient in maybe 3 or 4 months' time. There has to be everything that's important. First of all, the 5 cardinal signs of eye care: the vision, the pupils, the pressure, motility. Those things are basics. Those things should be repeated. Then slit lamp findings pertinent to your case, because this is a case of VKC. We would want to see that you've looked at the lids, lashes, conjunctiva, cornea, and you looked at the tarsal conjunctiva as well. And then you can talk about your management plan and how you explain to the patient about adjusting medications or using the medications or things like that. Your case will be sent back if you haven't given enough follow-up detail pertaining to that case. If you've written a case on binocular vision, for example, and you're doing vision therapy, for example, and you've done some BV exercises in the first visit, and on follow-up, you just write maybe a vague thing about visual acuity and some exercises were done, and then patient was doing well. We want to see what exercises were done. What was the progress report? Is the deviation reducing? Is the patient's symptom improving? There has to be something that's measurable on each follow-up visit rather than 1 line or 2 lines. I'm stressing this because this seems to be something that keeps recurring. So if you've put 1 or 2 lines on your follow-up visits, it will be sent back to you. Grammar obviously is an issue, although this doesn't carry so much points when it comes to the score sheet, but also it could make it easier for somebody to read your report, because when there are a lot of grammatical errors here and there, it's quite unpleasant to read. But considering that this is, I mean, we're an international committee, we don't place so much emphasis on your grammar, but that does not mean that it should not be properly done. And then another thing is keeping basics. Because you have written a case on, again, I keep going back to VKC because that's just easy to remember, but if you've written a case on conjunctivitis or you've written a case on glaucoma, for example, that does not mean that at the first visit, we don't want to see things about ocular motility, confrontation fields. Your basics must be there, except there is a reason. Maybe it's an emergency, maybe there's a foreign body in the eye and it's not appropriate to perform the test at that time. You need to mention that that's why you did not do the test. But if you just skip it and you go to what you think is important or what you feel is important, the reviewer will remind you. And then when you start to ignore certain findings that are absolutely important to the case that you're writing, it would come back to haunt you. Because I'll give you an example. If you've written a case on venal keratoconjunctivitis, you've described the conjunctiva, the bulbar conjunctiva, you've described the cornea, maybe the eyelids, but you haven't described what's going on the palpebral conjunctiva, or you haven't flipped the lids, the reviewer will remind you about that. And whether it's a case on glaucoma, for example, and you've talked about maybe the optic nerve OCT, you've talked about central visual fields or central corneal thickness, and then you skipped talking about the angles, maybe gonioscopy or doing Van Herrick's or something, the reviewer will remind you. So there's everything pertaining to what is absolutely important for your topic you need to cover. Don't just skip to what you feel is important. make sure you take it step by step. I already talked about the poor differentials. I already talked about follow-up visits. Another thing is forgetting to refract the patient. So even if your case is a pathology case and you feel like you have done a lot in terms of managing that pathology, at the end of the day, that patient still needs to be refracted. So you will be reminded if you have not, because just because someone has glaucoma and you've brought the pressures down, feels they're stable, and this patient is a presbyope, doesn't mean that they should remain N10 or N12 or whatever it is. You need to refract. And then your discussions. This is, becoming an issue because, people just write very short paragraphs on their discussion and then submit it. Your discussion is where you're able to express yourself. First, you discuss the case. Secondly, you discuss alternative managements that you could have done. And all these things has to be with references, with citation. And let it let it be in your own words. We don't want AI writing any of this for you. So ensure that this is your own words and you're writing about the case, discussing the way you managed or the reasons why you managed the way you managed with citations and other alternative possible management options that you could have done. And these other alternative managements may even be surgical. We know you may not be the one to do that particular procedure, but you should understand. Now, even if you do not have access to such treatment, for example, let's say you've written a case about meibomian gland dysfunction and you managed with warm compresses and maybe lubricating drops or maybe omega-3 supplements, what have you. It does not mean that because you don't have access to intense pulse lighting, you shouldn't write about it in your alternative management. You may not have access to it, but because you are intending to become a fellow of the American Academy, you're going to be held by global standards. So we want you to have an idea of that treatment, even if you do not have access to it. And if you don't write about alternative management, especially the recent ones, that have landmark clinical trials, those things will be brought up in your review and will be sent back to you. If you've co-managed a patient, always remember to include a report from whoever you've co-managed with or notes on it. And the last thing is not following the academic guidelines. There's a guideline for the way case reports should be written. You need to read through that guideline and follow the guideline. If you don't, you will be reminded that your case report will be sent back to you. So now that your report is back to you, how do you respond? First, I think Marike has already touched most of what I'm going to say here, but you need to highlight the areas that you have made changes in the report, in the revised report. No reviewer has that time to sit through and read through your 10 pages again when there are like 30 candidates waiting. So if you send a report and you may have revised it correctly, but you send it without highlighting the places where it's been changed, it would likely take a long time before you get your feedback, or it would just be sent back to you to highlight it. So highlight, so you see I changed the color there. So you can highlight it, you can change the font color, but don't do tracked changes. So the Academy typically advises against you doing tracked changes on the revised report. So highlight it or change the font. When you receive a comment, maybe it's about a particular management option you did not include, or maybe it's the reviewer questioning your choice of treatment, always back those things up with literature. So add the citations where necessary. Don't just respond and say, that's what I did, or I've had someone say, something like I think we had the reviewer had asked why was the reason this was not done, and the response was the ophthalmologist did not ask for it. Like that's not a sensible response. So you should respond as to why you did what you did, or why you did not do what you were supposed to do. Or if you disagree with the reviewer, fine. But if there is a practice guideline that states that this is the way this condition should be managed, maybe pertaining to your country, or maybe that's what's available to you. State that and back up your management with literature. If the reviewer has asked that you maybe add a new management in your discussion or asking why you did not do this, if you've actually maybe forgot to include something or you omitted to include something in the report, state it clearly. Because it makes no sense when, I mean, sometimes you would ask a candidate, for example, who has written a case on glaucoma, why was gonioscopy not done in this case? And all of a sudden in the next review, there is like 2 paragraphs dedicated to the angle structures. Did you actually do it in the first time, or did you just formulate some gonioscopy data to put in there? So first, make sure that what you're sending is correct. Secondly, when the reviewer has asked you to do something, if you omitted it, just state that you've omitted it. If it's something that requires you backing up the reason why you did what you did, always do it with literature and be polite in your responses to the reviewer. Now, don't assume that the reviewer would ignore a comment that you did not respond to. Oftentimes, reviewers find this funny or even annoying sometimes. Because sometimes a report comes back to you, or a revised report comes back to you with the comments in the score sheet, and you see maybe you've 5 sentences or 5 comments you made were ignored, and then just below below the 6th one, there's a response to that one. So what happened to the first 5? That report will be sent back to you very quickly. And it's okay for you to explain your thought process to a reviewer. For example, it may be a thing for where you practice that after cycloplegic refraction, maybe you call the patient back maybe 2-3 days after to do a post-cycloplegic refraction or subjective assessment to see what the patient will accept. Maybe the patient has latent hyperopia or something, and you do cycloplegic refraction, and then you want to see the maximum plus based on subjective a few days later. Fine. It's also possible for the reviewer, he sees no point. If you've done your cycloplegic refraction, just do your tonic allowance deduction and go ahead and prescribe. None of them is wrong. None of them is absolutely right either. But each person has his own way of doing something, and there is literature backing for it. Explain your thought process for why you've done what you've done. Make sure that there are citations for it, and send that back to the reviewer politely, as Marike has stressed. So don't sound aggressive in your responses. I think I've repeated several times about including citations and all that, and make sure that your reports are page numbered, so it's easy. I mean, the academic doesn't frown at it if you have line numbers, but it's not recommended either. But there should be page numbers, at least, so it's easy to draw your attention to areas. Now, why does it matter to respond to reviewers' comments? One, it's a way of defending your work and the way you've managed the patient, but it also helps you realize areas you can improve on, areas of alternative management, and it also gives you the reviewer's thought process, where the reviewer is going to, because that's most likely where your questions will come from during the oral exam. Because during the oral exam, if I've reviewed a case on maybe keratoconus, for example, and I've noticed consistently you don't seem to talk about the cornea findings. Maybe you just write cornea was clear and the diagnosis was based on corneal topography, and I draw your attention to it, and maybe your comment was maybe you did not notice anything. I mean, one of the questions I will put down is tell me about the cornea findings for keratoconus. So you tend to have an idea of where the reviewer is headed or what the reviewer is looking for when they write that first response. And keep in mind, it's mostly those areas that you sort of are shy to respond to, or you sort of play around responding to, and maybe you narrowly pass the case. The reviewer will put those things down and then ask you questions from there. Now, once you've made your response, the way that you're supposed to send that response is upload it back to the academic portal, the same way you uploaded the first case report. Change the title. So let it be, for example, Obinwanne Chukwuemeka Jr. revised case report 1. If possible, put a date in the thing. So it's easier for the reviewers to actually keep track of what you're uploading. You would receive 2 score sheets, which we'll go through in the next couple of slides, but you received 2 score sheets from 2 different independent reviewers. Ensure that you upload your response to each comment in the same score sheets. Some reviewers might want you to combine the score sheets together and respond to each comment together or create a new sheet. Do what your subcommittee chair has asked. So if your subcommittee chair wants you to respond on a separate sheet to both reviewers at the same time, do that. It would always be communicated to you in email. What I do in my committee is respond to each reviewer independently. And if you're not sure about something or you're not sure about what the reviewer wants you to do or it's not clear to you, always reach out to the reviewer. Now, this is reach out to your subcommittee chair rather. Now, this is an example of what the score sheet would look like. First, there'll be the candidate's name, the case report title, which reviewer, the date the review was done, and then the final decision. I mean, there's a 10-mark score, 10-point score for how complex the case is. The spelling, grammar takes 10 points. The way you've collected the data also matters. That takes 10 points as well. The way you do your that takes 20 points rather. Your discussion and diagnosis is 30 points. Your treatment and discussion is 30 points. Total 100. However, you need to score 70 to pass. So you need to make sure that your report is proper and is detailed. These comments will always come on this side. Now, you can leave your comments underneath the comments of the reviewer. So it could be just the way Marike highlighted. We could put response, thank you for pointing this out. You can change the font color or highlight the response so it looks different. And when you're responding to a comment, if a reviewer has asked, why is there no differential diagnosis in this report? Your response can be, apologies for omitting this. This has now been included in page blah, 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 paragraph blah, blah, blah. That way, when the score sheet comes and the revised report comes, the reviewer looks at the comments he made and he goes straight to where it is in your revised report. He doesn't have to start searching the whole thing, and then you get your response on time. Ensure that you change the font color or you highlight where you've made changes. Don't just assume that the reviewer will know. They don't have that time to read through. First of all, they're busy with their own personal lives, their work, and there are about 30 candidates waiting for feedback as well. So go straight to the point and make the job easy for the reviewer and yourself as well. Now, at the end of the day, what matters is the whole journey, the whole process of becoming a fellow. Because after the back and forth with your reviewer, a lot of times, I mean, we've all been candidates before, and we remember getting feedback and that back and forth or going back to make adjustments and stuff. It might seem exhausting, as Marika explained during her master's. You might want to pull your hair out sometimes when you get that feedback from the reviewer, and it's like every time there is some new thing there. However, when you look back, you would realize it's made you a better person because now you have been forced to go back and look at literature. You've been forced to see alternative management. You've become aware basically of why you should be practicing evidence-based optometry, and there should be a reason for the way you do stuff, not just because that's what you were taught or that's the way you've always done it. So it makes you a better clinician. So enjoy the journey and take each step seriously. Thank you very much.
Dr. Obi calls us to be an original, not to have plagiarism in our report. It should be less than 30%. I would rather say it should be less than 10%. 10% may be here and there. And artificial intelligence use of it is very unacceptable. You rather use the spell check on the Microsoft Word app and he believes in washing the case report with soap, subjective objective assessment plan strategy. And I do believe in the principles behind why create a case report or why to learn so many things around case report. It's because it improves your evidence-based approach and it sharpens your attention to detail. That is what I have experienced. I would very well agree with Dr. Obi that I went through this and it was a beautiful experience. And it made me forget as a clinician. So when you type your report, when you examine the person, you become a clinician. But when you compile a report, you should go back to your first year of your college, because there you shed all your ego, your experience. You do not think that you might know many things here. And that way you will be able to face whatever the reviewers come out with. And if you have nowhere to go, we always have our mentors like Dr. Levy, and we have Dr. Richter and Dr. Godwin. Of course, I went to my mentor, Dr. Levy, whenever I had issues coming out of these comments. It used to kind of demotivate me. I used to feel it was, I mean, this we do every day, and why we are being pinpointed on these grounds. But then eventually it sharpens your skills, you correct, and you come out the best. So yes, our report has to be coherent and sensible. And he mentioned about expanding on the follow-up visits. Especially, he gave an example of vernal keratoconjunctivitis, and on follow-up visits, we need to we would have examined the patient, but we did not explain it in so much of detail. So the person reading it would not know what we actually did at our clinic. And there would be a situation. I had a area where I felt it was quite different approach with line of management. It depends on your country and your scope of practice. Of course, we have the scope of practice where we can give in steroids, but in such cases, we do not straight away give steroids. We are very hesitant to give unless we co-manage with an ophthalmologist. That is because our patients sometimes come from outreaches, far off places, and then you give steroid. We do not know whether they'll come for a follow-up because of the transport issues, and they do not have a local clinic where they will be able to monitor. So these are the challenges which we need to explain. In my first report, I did not explain these things, but successively I realized that they are sitting somewhere else in a cool aircon room without knowing the challenges we face in outreaches or middle income countries, which we need to explain. I realized the mistake was also on my part. I did not explain to them the scene and the situation. So once we explain, they would understand and they will accept what we gave in and what we missed out. And you mentioned about glaucomatous and non-glaucomatous case, where when it is a glaucomatous, you go deep into explaining the optic nerve, head, cup size, and all that. But there was situation where it was an anterior segment case where we were asked in detail about the posterior segment also. So the best thing is to get back to basics. Think that you are a first year student where you are going to be exposed to the clinics or touching a patient for the first time. You need to go in detail, mention it all. I would say you should mention even the details, though it's not a glaucomatous case, it's an anterior segment case, but still complete the process. Just do not say the fundus is normal. They want you to explain what was the cup size, what's the color. And that is because they want to know whether you really used a scope and you know the things to assess in an optic nerve head. And we were not going to ignore the reviewers' comment, because then it will not go unnoticed. And we shall not forget to refract uh, post the pathology. So thank you for covering it very extensively and also giving examples. It was quite informative, and I could also reflect back what went right and wrong before in my own case studies. I would once again thank my mentor, because whenever we have these kind of challenges, I would say do not feel shy or hesitant to ask your mentor. I felt very free with Dr. Levi. I opened it all to him, and even said, I don't want to continue doing this because it is just demotivating me. And because of his motivating words, I went back and completed it. And I'm a fellow now, so I would always remember, along with my certificate, it will be Dr. Levi coming along as a picture to my mind. So thank you, sir, again. Now we would like to have few remarks from you as our overall mentor and our leadership here for the African chapter.
Yeah, thank you. Thank you, Tanuja. Thanks for the wonderful session, and thank you everyone for making time to attend this session. Like I posted on the chat, I love the conversations because it's a learning for all of us. It's a learning for me, it's a learning for anyone who is attending. We keep writing, so our writing is not only limited to case reports. So each time we write, there are times when reviewers come back to you and you kind of wonder, do they really know that you're the one who wrote this? And the reviewers are right. Anytime they review your document, you have to respond to it. You may be an authority in that field. It still doesn't mean that people will not find something uh, different when they read your report. It's a personal view sometimes that you still have to understand and take into consideration. So I love the comments, and I love everyone who has given insights to how the experience have been with this. For the academy, it's important because uh, it's an international body where people at different stages of their practice maybe reading your work. Someone could be reading your work from somewhere in Mexico, and you're writing from Kenya, for instance. They don't have an idea of what your clinic looks like. They don't have an idea of what your sample population of the patients look like. They're imagining so many things in their head, and they could be sitting somewhere like Tanuja said, in an office with cool AC, and they could have every facility to their beck and call, but you don't. So you can imagine when somebody is trying to put themselves in your shoes to see, do I really know how this person did this? Why didn't you use this CCT machine? Why are you telling us you did this? That's all in their head. And they want to understand. And genuinely, they really want to understand how you did this. And how could you make this diagnosis without an OCT? For instance, that's all in some people's head because they're not used to the environment you're working in. And I think this is where the African chapter made a very significant contribution by having some of our members become part of that panel to balance the arguments, to explain to certain people that this can be a case that you meet in Africa and you just have to deal with it. So this is where it's now helping us to really uh, portray our case, and I understand, there's a lot of us going through this platform, going through the academy process, becoming fellows, and I wouldn't say that's a bad thing. I get a lot of comments from people, colleagues who are telling me, Levi, there's too many people who are becoming fellows now. This is becoming an easy thing for people to do. Why don't you think the academy should change the standards? And I'm like, the academy wanted people to become fellows, just that they didn't know how to do it. Americans become fellows 1 year after graduating from their studies. These are young people. It didn't start with African chapter. It did not start with us here. We just didn't know how to do it before. But now we know. So this is why you're seeing more people get into the fellowship. And like I heard somebody say the fellowship made your work better. I mean, it was Maliki who said that, and that's what it does. You can't go through this process and come out the same. It's not possible. There must have been something you picked along the line. There must have been skill set that you've used that you keep using in practice. People come to your practice now and you start looking at them as potential case reports that you can present. So your minds are open to how can I do better? If I'm presenting this, would it stand the test of the academy? Am I representing this fellowship when I'm practicing? Do I live up to the standard of a fellow, that I hang in my room or in my office? So these are the things. It changes the mindset. It's a complete shift from the way we think before. And I think we would keep doing this and make sure that people who are interested in becoming fellows and really want to be excellent in what they do can go through this and sharpen their skills. And that's why this is important to us. So I really want to thank everyone for the speakers, great presentation. I know the time it takes to go in preparing this. I know you've invested time to making these slides, to making sure that people can understand what you're saying. I really do appreciate everyone. And for those who are joining, thank you for joining. The next session we are having is an explosive one. We're going to be talking about opportunities in the academy. There are different things that you can do after becoming a fellow. It doesn't end here. So there's something we're looking forward to. We want to open those pathways, explain to you how to get there. What is it like to become a diplomat? People ask me, Levi, so what's next when we become fellows? I say there's huge opportunities. You just have to explore the Academy website, go through those resource pages, and look at what's happening there. You will see that every day there are interactions happening. Special interest groups are discussing certain things each day. There's a communication part. There's a lot of things in that portal when you become a fellow that does open up. But I want to break those down in the next session. And I do encourage everyone to please do attend. It doesn't matter whether you're becoming a fellow, it could be a catalyst to make you see the need to continue doing this. If you've become a fellow already, of course, that's the thing you want to listen to. What can I do next after this? Because we all want to improve ourselves in any space where we work, irrespective of our level of education at that point. So I do think it's a time for us to really get back again and look at the opportunities that are there for us. So I just want to end this with saying thank you everybody for joining, and thank you Tanuja for the wonderful facilitation. I mean, I don't know how we found you somewhere, and great that you're here to support us in that space. I do really appreciate that. And yeah, I give this back to you again. Thanks, Tanuja, and thank you everyone.
Sure, sir. We can end with the closing prayer. Let us pause to thank the Almighty for what we accomplished and ask for clarity as we continue to strengthen our wisdom. Amen. Amen.
Amen. Thank you,
I think,
everyone.
sure,
Okay,
sir.
Thank you, everyone. See you at the next session.
All right. See ya.
So I can end the meeting, isn't it, sir?
Yes,
Yeah.
okay, I'll end it from here. That's fine.
Thank you.